You know, we are now less than 6 hours away from Ohio's new curfew. It changes to 11 p.m. tonight. And if hospitalizations go down, it could be moved to midnight or even be lifted completely. But even as Ohio relaxes that curfew, we're hearing words like mutation and variant now, words that in the middle of a pandemic could sound terrifying.
But as different strains of coronavirus begin to surface here, doctors say it's important to stay calm but alert. News 5's Mike Brookbank spoke with two doctors today about where things stand as our community tries to get control of COVID-19.
For those coming face to face with patients infected with COVID-19,
it is psychologically, emotionally, and physically very challenging.
A small but welcomed break as the hospitalization rate for those with the virus continues to decline across Ohio.
It is a bit of a respite.
Today at Akron General, the patient count is down to 61.
Put that in perspective, in early January, those numbers were close to 110.
Of course, we know that drop in hospitalizations is what prompted Governor Mike DeWine to bump up the state's curfew an extra hour.
Any aggregation of people, whether it's till 10 or till 11, in close, prolonged confines is exceedingly dangerous.
Dr. Brian Hart told me, even though we may have an extra hour to be out, it's best we stay home as much as possible.
And when you do get out, be sure you're wearing a mask and be sure you're staying at least 6 feet apart, regardless of the time of day.
Doctors like Hart asking people to double down on their efforts to control spread, as there's now one confirmed coronavirus variant in Northeast Ohio.
There's not cause for additional alarm right now because of these. They're still circulating in very low numbers in the region.
Dr. Christine Schmotzer tells me so far they've discovered the UK variant in just a handful of patients. However, those people may more easily transmit the virus.
That's the biggest concern right now, is that risk, that increased risk of spread.
If it gets a foothold in Northeast Ohio, the UK variant could become the more common strain and quickly send coronavirus case numbers the other way.
Even if the virus itself is not more lethal on a case basis, there'll be so many more cases, or there could be so many more cases, that the results could be tragic.
Both these doctors tell me, regardless of which form of the virus is out there, masking up, staying apart, and scrubbing our hands will continue to be effective in controlling the spread. Reporting in Cleveland, Mike Brookbank, News 5.